Imagine laying in bed with a fatal illness, learning that it could have been prevented with a simple vaccination. I will be discussing the history of vaccines and how they have been proven to be effective at preventing illnesses. I've worked in healthcare for 3 years. First started as at a family medicine clinic, and I'm now working at urgent care. When I worked at family medicine, I was the one giving the vaccines, and I discussed the importance of them with the patient or the patient's parent. And now working at urgent care, I'm not giving as many vaccines. However, I'm seeing patients with illnesses such as like varicella and measles that could have been prevented if they had the vaccination. Providing immunity against disease goes back as far as the 1700s, and this has been proven to be effective. Vaccines are a life-saving work of modern medicine that are underutilized, causing outbreaks of serious diseases. When these vaccines are used correctly, the case rate for these diseases can be greatly reduced, if not diminished altogether. Let's start with how immunity and vaccines were developed in the first place. Starting in the late 1700s, innovators and scientists were developing ways to create immunity without having to contract the illness itself. In 1976, Edward Jenner was a country doctor from England. He took discharge from a cowpox lesion from a civilian's hand, and he inoculated a young boy for 6 weeks with this cowpox matter. After the 6 weeks were completed, he injected 2 sites to the young boy's arm with the cowpox specimen, and the boy was completely unaffected by this. And he then concluded that this exposure to the cowpox lesion after being inoculated with it, that the cowpox prevents the population from smallpox infection. Stern reports that this was one of the many cases that Jenner had studied and completed since the 1770s. This was a great discovery, as prior to that, smallpox had killed about 10% of the British population. Louis Pasteur was a French chemist who produced a rabies antitoxin in 1885. This worked as an antidote to post-rabies infection. This was another major discovery in the medical field, as Stern reports prior to 1885, the cowpox inoculation for smallpox was the only reference that we had for vaccines. Now you might be wondering, how do immunizations work? Artificial immunity has proven to prevent many fatal illnesses, such as polio, measles, pertussis, and varicella. The immune system consists of different white blood cells, which all aid in infecting or preventing infection. The CDC explains that the first time the body comes in contact with an infection, it takes several days for these white blood cells to properly fight it off. After the infection, the immune system remembers that infection and then can fight it off quicker. This is done by buildup of what are called antibodies. Vaccines work by causing the immune system to build up those antibodies, however, not causing the infection itself. Let's look at how vaccines were proven to reduce pertussis rates in Japan. Why Immunize reports that in 1974, Japan had a successful pertussis vaccine. 80% of the population was vaccinated with this vaccine. At that time, less than 400 cases of pertussis were reported that year, and there were not any deaths from pertussis. The Japanese population started to believe that they didn't need this vaccine anymore since the rates were so low and not as many people were getting immunized. In 1976, only 10% of the population was immunized. And then this resulted in a pertussis epidemic in 1979, over 13,000 cases and over 31 deaths from pertussis. In 1981, children were being vaccinated again, and the case reports of pertussis started to drop. I'm going to be attaching a visual, a graph to the description of this video that shows the pre-vaccine rates, the percentages for cases pre-vaccine and post-vaccine. And you can see in that visual how much it drops just by utilizing the vaccines. With anti-vaccination being a hot topic, let's discuss what would happen if we stopped vaccinating. A lot like what happened in Japan, if the population does not use vaccines for immunity, diseases that have been suppressed will start to reappear. Hiki Pelota is a board-certified pediatrician, and he states that in the USA, there would be an estimated 3 to 4 million cases of measles, with 450 deaths, and 2,000 Hib infections, with 6,000 deaths. Earlier this year, there was a measles outbreak in Washington. This resulted in over 50 cases, and most of the people affected, or most of the children affected, were unvaccinated. Even if partial of the population refuses vaccines, this can still be damaging to the rest of the population. The CDC recommends a vaccine schedule, as certain vaccines can only be given at certain ages or during certain time schedules. And if an older adult or an older child or adult is unvaccinated and is then around a younger child who is not yet able to receive a certain vaccine, let's say varicella, for instance, the first dose is given at 1 year of age, can't get it before 1 year. So if an older child is unvaccinated and is around, let's say, a 6-month-old, they are then potentially exposing that young baby to the illness that they can't be protected against yet because they're not old enough. And this is how diseases are spread in largely populated areas like waiting rooms, for example, at the doctor's office. It's important to vaccinate to not only protect yourself, but to protect the others in the community and the entire population. To conclude, providing artificial immunity by inoculation has been proven effective for over 2 centuries. However, in order to continue to prevent contraction of various illnesses and thus avoid spreading them, vaccines need to be utilized. Vaccines are safe and effective and should be utilized by the entire population. Hopefully, all you will have to do is just imagine lying in a hospital bed with a preventable illness, as vaccines will have prevented such from happening.